Good evening and welcome to Diabetes and Your Heart. My name is Julie DeRoush. I'm a registered dietitian and a certified diabetes educator. And I wanted to talk a few minutes tonight about not letting diabetes break your heart. Did you know that the number one complication of diabetes is heart disease? Why is that? Most people think of amputations and other forms of problems, but diabetes is the number one, heart disease is the number one complication of diabetes. And that's because diabetes that is not in control, and I do want to make that point, diabetes that is not in control versus diabetes that is in control, is a condition where there's too much sugar called glucose in the blood. And if this condition goes on too long, the extra sugar in the blood can actually cause the blood to be sticky. Picture the blood moving like syrup off of a spoon or honey off of a spoon instead of flowing like water. That's what happens when there's too much glucose or sugar in your blood. Now, this isn't 100% accurate, but I think it gives you a nice idea of what's going on when the glucose is too high. Also know that when glucose is too high, you may not actually feel it. It can be moving around your body like syrup instead of flowing like water, but you may not have any signs or symptoms of that happening. Over time, this syrupy blood is going to cause problems just because it's sticky. Blood vessels that feed the heart, especially, can get blocked off because that stickiness in the blood is much more likely to catch things. And some of the things that are caught are fats, like cholesterol and platelets, and a few other things that can cause what we call plaque. And we may know plaque also as fatty deposits, and they can actually start to form in those blood vessels, especially the ones that nourish the heart. Over time, that plaque can harden, and we can see that the blood vessels actually start to narrow. And when that occurs, it makes it harder for the heart to get nourished. Just picture a blocked pipe. Okay, things do not flow well through pipes that are blocked. Plaque can even rupture, and when that happens, that can cause other problems. One of the bigger ones that you may know of is a heart attack. So sticky blood can kind of lay down the foundation or make make plaque stick a little bit faster than if the blood was not nearly as sticky and flowed like water. And what that means is that the blood glucose or blood sugar is in control when the blood is flowing like water. So, what can you do to stop or slow down effects of diabetes on your own heart if you know you have diabetes? And the number one, two, and three things are actually all tied together. First being get and keep your blood glucose or your blood sugar in control. We know if glucoses are in control a couple of different ways. Your doctor can do a test every 3 to 6 months, and many of you may have heard of this test. It's called a hemoglobin A1C. A hemoglobin A1C that is at or lower than 7% means your blood glucose levels are being managed or are generally in fairly good control. Another way we can know if glucoses are in good control is by daily testing of the blood. That's called a glucose. We use a glucose meter or a glucometer for that. We get a drop of blood and place it on a strip, and then the meter reads the glucose number. When that happens, it gives us immediate feedback as to how our glucose in our blood is doing. Depending on when you test your blood glucose, there's different targets or different ranges that we would be looking for. Lots of times those are individualized by your doctor, but in general, if you test your glucose fasting when you first wake up or before you eat, the target glucose would be under 130. If you test your blood after you eat, we do know that food makes glucose go up. And testing after you eat, approximately 2 hours is often what's recommended. The glucose should be under 180. And if we see those numbers on a fairly regular basis, that's going to translate generally to an A1C of about 7%. And we know that your glucose is in good control. There's some newer technology that measures glucose fairly constantly, and that's used by people injecting insulin. So that's available, and if you're injecting insulin, particularly fast-acting insulin, Humalog or Novolog, you may be able to get something like that, and that takes the place of pricking your fingers. The second thing to help slow down effects of diabetes on your heart has to do with your blood pressure. And we'd like to get and keep that blood pressure under control. The American Diabetes Association recommends that blood pressures be under 140 over 90. However, again, that may be individualized by your own doctor depending on your medical condition. So you have an idea when people are checking your blood sugar, blood pressure, it should be under 140 over 90. And then the last thing that can help slow down or decrease the risk of diabetes affecting your heart is to get and keep your cholesterol levels in control. Cholesterol levels are done generally every year. If they're in control, they may be done a little bit more frequently if they were elevated and you are trying to work on getting those down. So we're looking specifically at two cholesterols, your HDL, which I remember by using the word H for happy. That's what we call the good cholesterol. And in general, we'd like to see that number at greater than 40. We also have another type of cholesterol in the blood called LDL, and you can remember this as lousy or the bad cholesterol. And if you have diabetes, the recommendation is for that to be lower than someone who doesn't have diabetes. And we're looking to keep that under 100 if possible. And there is one other blood fat that's not actually a cholesterol level, and these also tie in with diabetes. These are called triglycerides, and that triglyceride level should also be under 150. So now we have some goals as to what to look for blood glucose or sugar, blood pressure, and cholesterol. So with that being said, how do we do this? Well, from a lifestyle point of view, we always go to trying to eat a healthy diet. If you are overweight or a little fluffy, a few extra pounds, trying to lose a bit of weight can help. Even something as small as 5 pounds of weight can make a difference in the blood glucose, the blood pressure. So, a healthy diet, you will find many different articles, trains of thoughts, all kinds of different information is available. But what we do know that a diet that has plenty of veggies, particularly of all different types and colors, is generally very healthy. A diet that includes reasonable portions of fruits, again, all different colors, can be very healthy. Using lean proteins and trying to have fish twice a week is another way to improve diet. Using whole grains, beans and legumes, and nuts is also considered to be healthy. If you use dairy, try and use lower fat dairy products like skim milk or 1% milk or low fat yogurt, because the fat that's in dairy is a saturated fat, and that can contribute to raising cholesterol. Other heart healthy fats would be things like avocados. And nuts and seeds are also heart healthy fats, and they do have some protein in them. So, a healthy diet consists of foods from all of these different groups in reasonable portions, so that if you need to, you may achieve a little bit of weight loss. So, to give you some examples of what healthy diets look like, we have some tools that we use. And one of the first tools would be the plate method. We recommend that half your plate be colorful vegetables, which you can see with the broccoli and the tomatoes. A quarter of your plate, and I should mention, a smaller plate is always a good idea. Our dinner plates have grown through the years, but a quarter of your plate should be a lean protein. You can see there's a chicken breast there. It could be a lean pork chop. It could be a fish fillet. And then a quarter of your plate can be a whole grain or a starch. And we see a sweet potato there that's chock full of vitamin A and fiber. Another example would be the other plate where we're having a salad that has some avocados and some nuts in it, and potentially some breadsticks, a few of those on the side. Well, those might even be a few chicken strips. I'm not quite sure when I picked the picture for this discussion. Turning to a healthy breakfast, again, using the plate method, we have a protein source, and in that protein, which would be an egg, we have wrapped in that plenty of different kinds of colorful vegetables. You can see the red and the green peeking out. We have a small serving of melon and some berries, and then a slice of toast. And that would be one way to healthy up a breakfast. If you're somebody who is leaning towards vegetarian meals, you can see that the other picture does have a sort of vegetable stew that has beans and peas and corn in it, and we would use a reasonable portion of that. Somewhere between a cup or two. These are just a few ideas of different healthy meals that you can use, and also these are ways to improve what your intake is, to achieve better blood glucose is maybe a little bit of weight loss. And by no means is this the only way to do that. There are several other ways to achieve healthier intake. Also, it's very important as far as how to protect your heart, to remember to move. We, um, in our jobs, at home in our leisure time, we actually do quite a bit of sitting. And oftentimes we forget to move. I know I'm guilty of this. If I'm at work and am busy on the computer, it might look up and an hour and a half has passed and I haven't gotten up. And boy, do my knees and everything else let me know that. So try and remember to move. Exercise is extremely helpful in keeping your heart healthy. And we should try and remember to move for about 30 minutes most days. Hopefully, that activity is something that you enjoy, that you look forward to doing, because let's face it, if it's something you're not too happy about doing, it tends to get pushed off. So remember to move. Another thing is to take your medications as prescribed by your physician, whether for diabetes, whether those are pills or insulin or one of the newer medications. It's very important to know what and how much to take, when you should be taking it. Also, take your cholesterol medications as prescribed by your physician, and blood pressure medications. Quite frankly, we're very lucky to have a lot of these things available to help control diabetes and blood pressure and cholesterol when perhaps when we didn't have these, diet and exercise alone may not have been enough to control these situations. Okay. One of the things that is also important, and believe me, I don't have all the answers, but learning how to manage stress, which is a part of our everyday life, can be very important in helping to control uh, blood sugars for certain. It can also help control stress related eating, which many of us kind of resort to if we're having a bad day. Somehow a cookie seems to help. But learning appropriate ways to manage your stress, whatever it may be, we find can be very helpful in contributing to decreasing issues with the heart. And there are several ways to do that. Activity is a wonderful stress management. In addition, we have different things like mindfulness, relaxation apps, ways to take your mind out of the stress loop when you have a negative thought or you're worried about something. We often just keep rethinking about that over and over. And it's a matter of retraining yourself to learn what can I do instead of thinking these thoughts that may be bringing up some hormone levels that might make my blood glucose higher or sending me into the kitchen for a big old bowl of ice cream. So stress management can be very important. Also, I don't think we talk enough about getting a plenty of rest. A lot of times, if we're very busy, uh, sleep gets put to the back burner. We can go to bed later. We might have to get up earlier for work or for family obligations. But getting plenty of rest can be very protective for your heart. And so practicing good sleep hygiene. What does sleep hygiene? That sounds like we're trying to clean up our sleep. And in a way, we are. Practice going to bed at the same time, having a nice dark room, perhaps putting away electronic devices about a half hour or so before you're due to hit the hay, and maybe using a sound machine or some relaxation tools to help you get ready to fall asleep. We do need somewhere, and it's a little bit different from person to person, but somewhere between 6 and 8 hours a day for most people. So, all of that being said, Where can you get help to understand or make a plan for you to do what you need to do to take care of yourself? Well, you can start with your physician. They will help with medications and potentially referrals to other professionals who can help you manage. A mental health professional, if you're experiencing extreme stress, depression, other things relating to medical conditions, particularly diabetes, can be very, very helpful. A diabetes educator. I am a diabetes educator. Also, I'm a registered dietitian, but diabetes educators are also nurses and pharmacists. Some physicians are diabetes educators, and we can help you set up a plan to manage diabetes and some of your other health conditions. I put a dietitian down as well because, in addition, some places don't have diabetes educators, but a dietitian can certainly be a resource for you in helping to consider, how do I plan a healthier meals, and what are my options. You can also turn to family and friends as some support buddies. Yes, depending on the family or friends. You might have to pick those wisely depending on who they are, but never underestimate the support of a friend if you have a goal you're trying to reach. They can help remind you or call you and maybe go on a walk or something with you, and that can also, your family can do that as well. So the good news is, if your blood glucose levels or your blood sugar levels are in good control, your blood pressure is in good control, and your blood cholesterol levels or blood fat levels are doing well, you will have a much happier heart. And what it simply means is that your risk of having heart problems or heart disease, since this is Heart Month, um, decreases if these three items are in good control. So you won't have to break your heart. As Elton John sings, "Don't go breaking my heart." So control the blood glucoses, the blood pressure, cholesterol, and your heart will be happier. Um, We do have a diabetes management center at KSB. I'm the current diabetes educator. We are located in Commerce Towers and Suite 121. You can see the phone number down there. And if you're struggling with any with areas relating to your diabetes, you need help with what to eat, how to take your medicine, your physicians can. We do require a physician referral, so talk to your doctor and they can send a referral over, and we'll call you and get you an appointment to come in and get you the help you need. So thank you very much for listening. I hope you found the information very helpful, and I enjoyed presenting it to you, and hopefully I will see some of you at our diabetes center. Thank you.